Hello everyone, my name's Maria. If you watched my trigeminal neuralgia story video, this intro will be a little repetitive, but if not, in short, I was diagnosed with trigeminal neuralgia in July of 2019 when I was 26 years old. It went away completely for 10 months and came back with a vengeance in June of 2020. Quick side note, as with my trigeminal neuralgia story video, I did make myself some pretty detailed notes, so if you see my eyes wandering, that is why. After still getting shocks every single day after about 3 months on carbamazepine, trying Aptium, a different anticonvulsant, and feeling quite hopeless, I decided it was time to think more aggressively about pain management than just pills. Now, mind you, before having microvascular decompression, the only surgery I'd ever had before was getting my wisdom teeth taken out. I take a pretty naturopathic approach to medicine in general, and I'm definitely not one who is like eager to take prescription meds, and definitely not someone who's eager to just fix something with surgery. So for me to get to this place of even truly considering brain surgery was big. If you want the whole picture of exactly where I was at pain-wise and stuff and why I was finally like, okay, let's talk surgery, you can check out my trigeminal neuralgia story video for that. So back in 2019, when I very first Googled, why does my face feel like it's being shocked with electricity, the very first video I ever watched about trigeminal neuralgia was a neurosurgeon named Dr. Lim. He was talking about what it is, what causes it, and what can be done about it. So from day one, I knew Dr. Lim's name, and seeing as he was the director of the Trigeminal Neuralgia Center at Johns Hopkins made him a top contender to be my surgeon. But I wasn't going to just pick the first name I saw, so I continued researching a ton. The name of a neurosurgeon where I live in Denver, Dr. Prowl, came up from 3 different people, so it was enough for me to at least want to have a consult with him. He was actually out of town, so I ended up meeting with his PA, and I just didn't feel like this was the right fit for me. And here's the thing, is I probably could have gone to any highly respected neurosurgeon and had good results, but this is brain surgery we're talking about. I wasn't just about to leave that up to anyone. There are a decent number of neurosurgeons around the country who do the microvascular decompression surgery, but also do many other types of neurosurgeries. I wanted to find a surgeon who specializes in microvascular decompression and had devoted their career to perfecting that craft, not just a neurosurgeon who does an MVD here and there. Then somewhere in my research, I don't even really remember where or how, I came upon the name of a surgeon named Dr. Zimmerman, who is a director of neurosurgery at Mayo Clinic, Phoenix. After reading everything on the internet that I possibly could about him, I made an appointment to have a telemedicine visit with him on August 11th. I learned that he does a Teflon-free microvascular decompression, which is not the norm. The typical surgery involves putting a piece of Teflon in between your trigeminal nerve and the blood vessel or artery that's compressing it. But the procedure Dr. Zimmerman does doesn't involve using any Teflon or putting anything foreign into your actual head, which was very appealing to me. The only foreign thing that I have in my body is a titanium plate and screws that were used to close my skull after removing the bone. So it boiled down to, do I want to go with Dr. Lim, who had actually just moved to Stanford and does the traditional MPD surgery with Teflon, or do I want to go with Dr. Zimmerman, who takes a much less traditional approach without the use of Teflon? The MPD with Teflon is the tried and true method with much more written about it, whereas the Teflon-free microvascular decompression is much less well known and has very little written about it comparatively. So you can see how I thought the Teflon-free method was much riskier in that sense. It was choosing between method A, that's been done for as long as the surgery's been around and has so much more literature published on it, and option B, which for a time seemed like it was pretty much just taking the surgeon's word for it that it'll work. He's been at Mayo Clinic for 30 years and has done this surgery without Teflon for decades, so he's obviously a genius, but still I wanted the proof. At this point, I'd had 2 consults with Dr. Zimmerman and 2 consults with Dr. Lim, and had spoken with former patients of both of theirs. Dr. Lim actually asked me if I would want to speak with a former MBD patient of his, so of course I took him up on that. He gave her my contact information, and then she reached out. Now, knowing this was a thing, I asked Dr. Zimmerman to put me in contact with a former MBD patient of his too. It was helpful and reassuring to hear firsthand from both of them what it was actually like under each surgeon's knife. Both surgeons made really great cases for themselves, so when I was really at a crossroads, I literally pitted them against each other. They both knew that I was talking to each other. In an appointment with Dr. Lim, I had asked, so here's Dr. Zimmerman's case for no Teflon, what's your rebuttal? And in an appointment with Dr. Zimmerman, I'd say, so here's Dr. Lim's case for using Teflon, what's your rebuttal? That might seem a little aggressive to some, but if you can't clearly explain what you're going to do in the OR and why it's going to work, then how can I trust you, right? In short, Dr. Lim said Teflon has just always been the way to go and is most widely used in accepted practice, and he's had a ton of success doing it. And in short, Dr. Zimmerman pointed to the potential hazards of Teflon over time, particularly that it can harden and the pulsations from the artery get transmitted through the Teflon and onto the nerve, and you're back in the same situation of having shocks. Just logically, the Teflon-free method made so much more sense to me, because if the issue is something, your blood vessel or artery compressing the nerve, it didn't make much sense to me to just put Teflon in between your blood vessel or artery and the nerve, because now the Teflon is just rubbing against the nerve instead of the blood vessel or artery. But the problem I had was a good problem to have. I have 2 surgeons who are experts in their field, but who is the best. You can probably hear that I was very much leaning towards the Teflon-free MBD, but I still had my reservations and wanted more clarity and assurance from Dr. Zimmerman, but I was having trouble with coming up with exactly what to ask him in order to get to that level of confidence that I needed to get to in order to actually go through with it. So the day before my last consult with him, I pretty much called a town council with some of the most important people in my life. The night before, I literally was like, okay guys, 10 a.m. tomorrow, board meeting. It took a lot of humbling, but I was like, hey, I'm really struggling with this decision and I need y'all to weigh in. It was super helpful, and I really encourage anyone struggling with a huge decision to swallow your pride and ask for help from people that you trust. I actually recorded every telehealth appointment I had with both of them so that I could go back later and revisit them and take notes. So I'm actually going to just read what he said in response. He said, in a young person like you, we hate to recommend continued medical management if there's a way to fix what's really wrong. When you treat trigeminal neuralgia with gamma knife or rhizotomy, they damage the nerve. They damage it to reduce the functioning of the nerve so you don't get those triggers. So it makes it less sensitive by damaging the nerve, but it also runs a major risk of making your face numb because it's ruining the normal functioning of the sensory nerve. If you damage a nerve and it heals abnormally, you can get anesthesia dolorosa. In a young patient, we try to avoid giving you radiation because there are radiation-induced cancers that you could develop. So when I hung up from that third Zoom call with him, I immediately was in tears as I called my mom. She asked how the Zoom call went, and I just said I had this overwhelming feeling that this was it and don't look back. My gut or God, or probably both, were giving me the answer that I needed, and I don't argue with that. I was confident that I'd done my homework, had given it plenty of thought, and had done my due diligence in finding the perfect surgeon for the job. From the time I had my first consult with him to actually having surgery was a little over 2 months, so it wasn't a decision I came to quickly. So I flew to Phoenix, and on October 16th, I had microvascular decompression surgery with Dr. Zimmerman on my right side. I was in the operating room for about 5.5 hours, spent 2 nights in the hospital, and flew home 2 weeks later. My surgery recovery was a lot rougher and longer than most people's, and in my first post-op visit with Dr. Zimmerman 13 days after surgery, he literally said, there's no doubt you've had a much bumpier course than most. I tell you all of that just so you'll know that all of what I'm about to go into is not at all expected or the norm, but it can happen, obviously. For the first few hours after coming out of anesthesia, I was throwing up, and then for about the next 48 hours, I had nystagmus, where your eyes shake, vertigo, and was super nauseous but not throwing up. Then for the next few days, I had double vision, my depth perception was off, and my vision was blurry for about 2 months and is still getting incrementally better every week, so I'm very hopeful that it'll get back to 100%. Also, sorry that during this part I'm looking at my notes quite a bit because I think just subconsciously I kind of just blocked so much of this from my memory. So for about 2 weeks after surgery, I had a migraine that was super bad for the first week and then gradually got better with the help of migraine meds. I pretty much slept for that whole first week, and then for about a month I had pretty bad neck mobility and stiffness, so I started going to PT and chiropractic using Tiger Balm and wearing a heated neck wrap. I wondered why my neck, particularly my sternocleidomastoid, would spasm every time I laughed or chewed and was so stiff, but come to find out that in surgery, some muscles have to be temporarily moved, so they're literally recovering from trauma. So in the surgery, he cut open my skull behind my ear, about a 3-inch incision, cut through the dura, which is the thick membrane that covers your entire brain, move my neck muscle, then uses 2 metal retractors that are sutured into place to hold the dura and muscle out of the way so he can actually access my brain. You're on your side for surgery and your head is in this halo brace to make sure it stays extremely still. Luckily, my hair grows pretty quickly, so here's where we're at today. Anyway, the real post-op kicker was this. 12 days after surgery, the day before my first post-op appointment, I woke up with Bell's palsy. Between the carbamazepine I was still taking, the medicine for the Bell's palsy, muscle relaxers, migraine meds, pain pills, there was a period of 2 weeks where I think I was taking 13 pills a day. It was a lot to keep track of, so shout out to my mom for literally making me a spreadsheet of what times I needed to take what meds. I'll have a whole video on the Bell's palsy too if you're interested, but in short, I think with the help of PT and chiropractic, it went away almost entirely in about 7 weeks. So, like I said, none of that is the norm. My surgeon told me that he has literally never had someone develop Bell's palsy after neurosurgery, so just know that if you're watching this because you're considering surgery, from what I've heard, most people have a headache for like a week, and that's about it. Alright, that's the long of the short on how I came to the decision to have surgery, which surgery I trusted more to hopefully provide a lifelong cure, and therefore which surgeon to go with. Now, almost 3 months later, I think I can finally say that I'm glad I did it, despite all of the pain and side effects that came after surgery. I'm off carbamazepine completely, although it took 2.5 months to be able to completely wean off of it. If you're interested in more on my actual surgery experience and what pre-op stuff I had to have done and things of that sort, I have a whole vlog style video on that too that I filmed while at Mayo Clinic. I'll also probably be making some sort of update video in a few months, so stay tuned for that. I hope that I can tell you in a few months that I am still glad that I did it, that I am still shock-free, and that I would do it again. Alright, that's it for today. I hope this video was helpful, insightful, informative, etc. Thank you so much for watching.